1907, Dr. Alzheimer, who was a German psychiatrist, attended a conference in Munich, and he presented a case of his patient, Augusta D., that you can see here. She's a 51-year-old woman who he described the first symptoms of her illness as suspiciousness of her husband, which to me doesn't seem abnormal. But soon after, she had significant memory loss. She was dragging objects here and there. She was not able to orient herself in her own dwelling. And at times, thinking that people are out to murder her, she started screaming loudly. When she passed away, Dr. Alzheimer requested to look at her brain and examine it. And he found two pathological hallmarks that are still characterizing the disease: beta amyloid plaques, amyloidosis, and neurofibrillary tangles. And indeed, more than 100 and something years after that conference in Munich, we still have no cure for Alzheimer's disease. It is a disorder it's a brain disorder that is characterized by progressive memory loss, by difficulty remembering names, events, recent things that happened, a lot of confusion, a lot of difficulty orienting yourself spatially, so you could go to the park and do not remember how to get back, poor judgment, and again, no cure. So why is it a problem? It's a problem because we have a growing number of individuals that have the disease. We have currently about 6.7 million Americans living with Alzheimer's disease. And if you look at other disorders such as heart disease, stroke, and so forth, the percentage change in cause of death is declining, while in Alzheimer's, it keeps rising. Now, obviously, the most significant risk factor for Alzheimer's disease is aging. We're all aging, and this is not good. So, in my lab, we are using patient stem cells and patient cells, generally speaking, brains of those patients, and also mouse models of Alzheimer's disease in an attempt to understand what causes memory loss, what is the vulnerability of the brain in Alzheimer's disease, and of course, to develop new drugs to treat the disease. Thank you.